Good afternoon. I'm Steve Wolfson, the chair of the Council of the State Medical Society. Senator Giarratana, Representative Ritter, and members of the Public Health Committee. On behalf of the physicians of the Connecticut State Medical Society, thank you for the opportunity today to present this testimony on Senate Bill 67, an act concerning the authority and responsibilities of advanced practice registered nurses. This 94-page legislation contains 79 sections in which Connecticut general statutes granting physicians signatory or certification authority is extended to APRNs. CSMS agrees that most of this bill is a natural progression of the independence of APRNs, but we must oppose introducing such broad legislation that has such a dramatic impact on care delivery without a thorough review of the implications of each of these statutory changes. In most situations, these changes may be appropriate based on practice situation and the level of independence of the APRN. However, prior to simply passing this legislation, we feel that there should be an opportunity to review each section individually and discuss as professionals what requirements should be included. There are far too many potential issues to enumerate and review in the time allotted to this 94-page bill, let alone to discuss today in the time allotted to me. But as just one example, Section 46, Section 20-631 allows an APRN to enter into a collaborative drug therapy management arrangement with a pharmacist. These arrangements, heretofore between a physician and a pharmacist, could create a situation where an APRN in a collaborative arrangement with a physician is secondarily collaborating with a pharmacist, creating a tenuous chain of command and the potential to do harm. Many pharmacies already employ in-house APRNs, a situation that could allow for unprecedented and inappropriate exploitation of the process by large corporate retail pharmaceutical entities. We believe that it is imperative that we collectively agree that we are making the right decision in any situation in which statutes are changed to provide increased abilities to any profession. We believe it is imperative that our professions and this committee work together to review this legislation in a more detailed manner to ensure that we all are acting in the best interests of our patients and those we serve. We look forward to working with the committee and our APRN colleagues to accomplish this goal. Thank you.
Thank you, Doctor. And there might be questions.
Thank you, Mr. Chairman. Thank you, Dr. Wilson, for being here this afternoon. Good to see you again. And the request that our chairman has is exactly the request I was going to have for you as well. I mean, it's a huge document. There are sections that obviously that you have no concerns with, society has no concerns with at all. And so those low-lying fruits, if you're able to look at and say, hey, this can be passed, and the other areas where work needs to be done, so where we need to sit and have a conversation so we can optimize and do the right thing by patients, I think to me that makes logical sense. So you gave one example in your testimony in your limited time, but my assumption is there are other sections as well that are troubling to you and to everyone else. And those, if you could highlight to us, and so that we could continue this conversation and see whether we include them in this particular bill or hold them for another day for another discussion.
Absolutely, and we look forward, frankly, to talking with the representation from the APRNs about this. I think it's in all our interests to come up with a better bill.
Thank you, Dr. Wilson. Thank you, Mr. Chair.
Sounds great and agreeable.